All right, I'm seeing 301, so we're going to go ahead and get started. Hi, everyone. Welcome to today's Open Take 30 Medicaid cuts and the impact on oral health, what to expect. We're going to go ahead and get started. We have two really great speakers here with us today to help us understand both what the federal proposals are and what they could look like in states and their impact on oral health. We're going to first hear from Bailey Rivas from Families USA, who will walk us through what's currently being proposed in Congress and what to expect in terms of the political negotiations that are playing out pretty much as we speak. So Bailey, I'm going to go ahead and turn it over to you.
Yeah, thank you so much, Melissa. Happy to be here. I think just to quickly dive in, Families USA, for those that might not be familiar with us, we're a national consumer nonprofit organization that is really focused on achieving affordable and accessible healthcare for all. In the oral health world includes expanding coverage, but also ensuring that really once families have coverage, they can get the dental care they need at prices that don't leave them bankrupt. But we work across many healthcare issues, and in this moment, particularly a lot of work on Medicaid. So I think many of us are aware how important Medicaid is, and I don't mean to speak on something that everyone's like, yeah, we know, we're already here. But I just did quickly want to, I think, just ground us and set a foundation for just all of the way that folks rely on this program for access to affordable care. I know all of us here are very focused on the oral health piece of it, but obviously it's just a tremendously important program for so many. And while we'll be talking about the specific oral health angle in this conversation, there's just so many different ways that folks potentially could be impacted by what's being proposed. That'll just be devastating across all types of insurance, but particularly across all aspects of healthcare for folks who rely on Medicare. So Medicaid, sorry. So and people in so many different aspects of this country, 14 million rural Americans, 7.2 million seniors. A lot of this conversation has been focused on Medicaid, but so many folks who are also dual beneficiaries and rely on Medicare and Medicaid will be impacted. Almost a million veterans rely on it, and so many folks. So just kind of wanted to have this slide to remind all of us the importance of this program, not just within the oral healthcare space, but just across it as well. So um, looking forward, there's been a lot of conversations. I'm sure folks have been, tracking it in various aspects, but, what is happening as of today on, this bill that folks are hearing about. So, Congress is using this budget reconciliation process, which can often be a very technical thing and very complicated. But the gist to remember is that it's a fast track tool that allows the Senate to pass something on a simple majority versus this typical 60 vote threshold. That's especially important in this moment while we're grounded in the Senate. But the entire reconciliation process is essentially geared around that one thing, just allowing Senate to bypass that 60 vote filibuster rule and require only a simple majority. Um, the House passed in late May, HR 1, the One Big Beautiful Bill Act, as the technical name is, that included a lot of different priorities in it, but the main focus for healthcare is that there were pretty significant and steep cuts to the Medicaid program. It's the biggest cut to the Medicaid program in history since it was created. As laid out here, the cut itself was $858 billion. The cuts and changes that were made to the Medicaid program to provide this number were kind of spread out across a number of different specific provisions. The biggest one was forcing states to change the way that Medicaid is financed, and a lot of the structures states rely on to fund their Medicaid programs. I think some of the most uh, uh, impactful changes that were included were it froze provider taxes at their current level. So it didn't decrease them, but it said that you cannot increase provider taxes where they are now at 6%. And it restricted some state directed payments. And then, as I'll cover in a minute, it also did tinker with some FMAP. But what we did not see, which is the federal matching that states rely on, which is federal dollars going to states at a matching rate if they've expanded which is particularly higher if they've expanded Medicaid. Um, what we did not see that was really in the ether, and I think in large part was not included due to so much of the powerful advocacy that folks here and, across the healthcare space was we did not see, there was a lot of conversation about reducing that federal matching for expansion states entirely. And while there are many harmful aspects to it in this bill. I do think that it is important to kind of note where we have been successful already in our advocacy. And I think the pretty tinkering with FMAP under certain circumstances was in and of itself a huge show of where our advocacy has already made really big inroads. Other changes that the House made was it added pretty significant bureaucratic burdens for enrollment and additional paperwork. I think this is most notable in what people are probably familiar with as work reporting requirements, which just requires folks who are eligible for Medicaid to essentially put forward additional documentation proving the work that either they are working or that they're eligible for Medicaid to not be working. But it just means that a lot of folks who are eligible for Medicaid, who should be getting that coverage, are likely going to lose it because they just will not have submitted the proper documentation under the strenuous timelines. The bill also required reapplication for certain communities every 6 months, which again just means folks who are eligible for the program are likely to fall off because they are not submitting paperwork or fulfilling, kind of this like red tape requirement needed. Other changes include create cost sharing for adults in expansion population and then reducing FMAP for states that use state dollars to cover immigrant families' health coverage. So that's what was in the bill that the House passed at the beginning of May. Since then, that this conversation has moved over to the Senate. The Senate has been crafting their version. Last week on Monday, the Senate Finance Committee, which is the main committee of jurisdiction for healthcare, released their proposals. And I think, and what is both disappointing and, to be honest, a little surprising, they really seem to have doubled down on a lot of these bad policies from the House and kind of made them even worse in many ways. I think this is most notable in that they put harsher cuts for those provider taxes. So provider taxes are taxes that states can levy on a number of different sources, including nursing homes, hospitals, doctors' offices, and essentially the money that states get helps them cover Medicaid costs, but often is used to essentially reimburse Medicaid providers at a higher rate. So a lot of these providers are happy to pay these higher taxes because it leads to them getting higher Medicaid reimbursement rates. While the House froze it, we see that the Senate has frozen it at that 6%, but then for Medicaid expansion states, it does require them to reduce it from 6% to 3.5% over time. So that's going to be extremely significant. I think we're seeing a lot of concern from folks about the impacts that'll have, particularly on independent rural hospitals. I think that's kind of the most talked about part of this whole package is that they're really doubling down on this provider tax piece because it gives them significantly higher savings because it's a deeper cut. It also included harsher language around the work requirement, which applied to a broader community. Essentially, the House version was a little bit more flexible in regards to parents with children. This one's less flexible for the age range that it requires. And additionally, it's more expansive provisions about banning access to Medicaid for communities that typically have been eligible, such as families granted asylum, refugees, and a lot of other at-risk immigrant communities. So we see them like really focused on reducing Medicaid access for immigrant communities. One thing that's not here, apologies, in the House version and in the Senate version, is it also targets states that are providing gender affirming care. And many other targeted community changes. So I have here in bold policy changes are still ongoing. As Melissa alluded to, these negotiations are still happening. So this is what the Finance Committee has put out there. We've already seen really significant pushback from Republican senators, particularly on that provider tax piece and their concerns for what it means for their just generally healthcare access in their state, but especially for their rural hospitals. There has been some conversation about a rural hospital, essentially additional fund to kind of help provide them support, which means they're cutting something to spend more money, which is just a very interesting take on a policy solution, in my opinion. But even then, we're hearing some early quotes from senators who are concerned that they don't believe this like special rural hospital fund is going to be enough to assuage their concerns. So there are a lot of changes that could be going, which is a good segue into what's next. Where is this, now that we kind of have an idea of what policies we're talking about, where are we going? The Senate is really looking to try and pass something this week. That means that they would really have to put a final bill on the floor today or tomorrow because of Senate procedure. They essentially have a required 20 hours of debate 10 of those could be waived by Republicans if they chose, but that means that they still have 10 hours of debate that Democrats would certainly keep. And then they would go into a process known as votorama that folks might have heard about, which essentially just allows any senator to put forward an amendment, and they will go as long as people are putting forward amendments. So that can be an all-night process, it could be a multi-day process, it really just depends. So best case scenario, if the Senate wants to pass something over the weekend, they have to put something on the floor really today or tomorrow to meet that deadline. Majority Leader Thune has said that the Senate will stay in session until the bill is passed. They are supposed to be going on recess next week for the 4th of July recess. I think depending on how these provider tax conversations go, will really determine if they are staying, if they can, potentially get some late breaking changes to get enough senators on board that they feel like they have the numbers. The Senate can lose four uh uh can lose 4 votes, or they can lose 3 votes. At 4 it's a tie, and therefore they won't be able to break the tie, so they can lose 3 votes in order to get to the tie. Sorry about that. It's a 4-seat difference, they can lose 3. So I think it's a real still seeing how things shake out on the Senate side. Looking at the House side, the House, because the Senate made changes to what the House passed, it does have to go back to the House for them to vote on it. Um, Speaker Johnson is saying that they are again like planning to stay in session through the 4th of July recess. If the Senate is able to get it to them this weekend or early next week, they'll stay in session to try and jam it through. However, we have seen that there are a significant number of House members that have a lot of issues with the proposed Senate changes. There are 2 issues that are really kind of bubbling to the top right now. The first being state and local tax concern. This was a big piece of debate during the House process initially, where you had about 6 or 7 members from mostly New York, but New York and California around the SALT tax, and increasing, the pieces of that. I'm not a tax person, so I don't want to speak too specifically on it. But we also have seen that there are about 16 so far House Republicans that, as recent as yesterday, put out a letter saying that they don't agree with the Senate proposals, particularly on this provider tax concern. So, best case scenario, the Senate passes something by this weekend, which still feels like an uphill battle. They definitely could do it. We saw the House, had put a really in what I thought was an unrealistic timeframe for themselves, but was able to make it happen. But I think between this provider tax piece, we also know that there are a couple of folks who are likely to vote no just because they don't think this goes deep enough on the cuts, such as Rand Paul, and potentially Ron Johnson out of Wisconsin. So best case scenario, the Senate passes this weekend. It has to go back to the House. The House potentially could try and pass it next week, before the 4th of July. But again, these are just extremely tight deadlines, and it seems like there's still a lot of disagreement. So it's going to be a day-by-day process. This 4th of July deadline is self-imposed. They really have technically until September 30th to get this done, when they would need to be looking at next year. That's when the fiscal year essentially runs out for the government. So that's the only real deadline that we're talking about here. But the 4th of July is one that they seem to still care a lot about. So, what does this all mean for oral health? I think essentially this most significant impact we'll see is on adult Medicaid oral health access. It is not mandatory and is the most at risk of being cut if, or being made less comprehensive or fully cut as states are potentially looking at losing Medicaid funding. We're seeing these 2 main policies in here that are most likely to affect it. The first being this provider tax piece that I mentioned that's really already causing a lot of heartache for the Senate. But because states really rely on provider taxes as a pretty significant share of their funding apparatus, if this is to be frozen, best case scenario, which is what the House put forward, or pared back, what the Senate is proposing, it would really significantly reduce the number of dollars states have in their budget and just makes oral adult Medicaid benefits really vulnerable to being reduced or being fully cut, considering state budgets are usually so on the margins, which I know folks here are more familiar with even than me. The other piece I did just kind of want to highlight is these eligibility changes mean that millions are going to lose coverage, and people who are actually eligible, as I mentioned, which means you just have a lot of people that should have access to oral health coverage through Medicaid, that would potentially be losing really what could be their only affordable access. So I think these are the two places at this time frame, but just generally, a lot of these reforms are meant to reduce the number of dollars that state Medicaid programs will have or put additional burdens on state Medicaid departments. And anytime we see things like that, we know that it's just going to reduce the non-mandatory coverages because they're operating on the margins. And so oral health is just extremely vulnerable. We've seen it happen before in states that have had budget cutbacks, that oral health is often one of the first things to be removed or coverage made extremely less, extremely pared back, and functionally non-existent. So we just know that as states are going to be looking at their budgets, it's really on the line. So I'll be really quick. I'm sorry, I know I'm low on time. Just quickly want to run through some of the strategies that folks, if they haven't been engaged in this, the biggest thing is honestly talking to your members of Congress in this moment, talking to your senators on the importance of Medicaid, on the importance of oral health, on how all of these things impact your state budgets, and really putting a human face on these faceless budget numbers. As said here, we're always talking in data, but you all have the like people that you work with on the ground who would be impacted. You know the hospitals in your state that will be impacted. You know the pieces that matter most in your state, and being able to get that in front of your senator is extremely important. And I'll just say, so often the thing that I hear from folks is like, oh, I live in Florida, I live in Kansas, and like, we have these Republicans that like they don't care, but this is actually a moment where we're seeing pretty significant pushback from very conservative members. Josh Hawley has been one of the loudest voices on protecting Medicaid. He is a very conservative member. We're seeing that Roger Marshall from Kansas is a very conservative member, and not in a million years did I think that he would be concerned, but he is. I was just saying before this call, Tom Tillis from North Carolina, when the Senate finance language was released, said he was a yes and this was fine. And today we're seeing that he said that he's a no vote until he gets a greater understanding of what's happening here. So we're seeing that this is mattering. We're seeing that even extremely often conservative, normally not healthcare members are worried here. And so I think that our voices and our work is really impactful in this moment. I can definitely make sure this gets passed around and follow up, but if you scan this QR code or you dial that number, that'll direct you to the House zip code. We also have a letter that you can send in to your senators as well if picking up the phone isn't your style. So sorry, I think I definitely went over time. Really appreciate it, and looking forward to answering questions later.
Thanks so much, Bailey. Really appreciate your insight, and no worries. There's a lot happening right now, and this is detailed policy that we need to all understand and be able to advocate around. So appreciate you walking us through it. Before I turn it to Gary, I will just say we're going to send out materials and follow up. I do also encourage folks to go to CareQuest's website to learn more about Open and joining Open and being part of these ongoing conversations around this issue and many others. If you have not already done so, we can put that link in the chat, and there's also slides in this deck that get to that. And we will share these materials and others, including a resource that CareQuest, Families USA, and Community Catalyst collaborated on, kind of describing the fallout we've seen in states where they've made these kinds of dental cuts in the past. And so all of that to come. And speaking of experiences in states, I'm going to turn it to Gary to speak about what these kinds of federal cuts could mean for oral health access in Missouri. Go ahead, Gary. Oops.
Thanks. Really, really good presentation, Bailey. I appreciate all of that. It's so very relevant. So I'm just going to give you a little bit of an orientation to Missouri really quick. That's our map. We've got a funny shape. 6.25 million people live in Missouri. 1.3 million are eligible for Missouri Medicaid, also known as Mo Health Net. You'll probably hear me use both of those terms. Much of our state is rural, but we do have urban areas in St. Louis, Kansas City, Springfield, and Columbia. St. Louis collectively is the largest urban area. And it's also important to understand that we have 8 contiguous states. I just wanted to mention that. So, and a little basic on Missouri Medicaid. Comprehensive dental is included for children, residents of nursing homes, people receiving the Blind Pension Fund, and pregnant women. They're covered for a full year postpartum. It used to just be 90 days. We were able to move that up a couple of years ago. The general adult population eligible for Missouri Medicaid has a limited benefit The big gap there is it doesn't have dentures and crowns, and there are some other limitations, but I'm not going to go into all those details. Our Medicaid system is both fee for service and managed care, so there's some complexity there. Missouri is in a unique position. We are an expansion state, but we did it by petition initiative or referendum, and it was done to amend the state constitution. So that means it can't be easily eliminated. It's not like the state can just then choose to ignore that constitutional amendment. So that's about 350,000 people that are in that expansion population. We also have some pretty difficult math going on, kind of even separate from all of the federal stuff. We have a set of phased-in tax cuts that were passed several years ago, and probably that is finally going to start to come home to roost for this next state fiscal year, which was July 1, 2026 through June 30th, 2027. That'll be passed in the next legislative session, which starts in January. And so then as a result, you have the state budget director, Dan Haug, coming out and saying publicly and in meetings, we're running out of money. So this quote here, the times are going to be getting tougher as we go forward. And so I think we would like to try to limit general revenue spending so that we're able to craft responsible budgets. So that's happening anyway, even if there's no cuts at the federal level. But deep cuts in the federal portion of Medicaid will require state funds to make up the difference. And Missouri really doesn't have it. And we don't have a good way to get it. So deep cuts in Medicaid could make the state start thinking about what else do we need to cut besides all the things in Medicaid. So that's a really pretty stark picture that we get. The current estimate, when you get down to the particular things that are being talked at the federal level, is that as many as 161,000 Missourians will lose Medicaid eligibility. That's really under the House proposal. We don't really quite have analytics on the Senate, but at the House level, 28 billion less in total Medicaid funds in 10 years, 2.7 billion in 1 year. That's from Manat Health. They may have new numbers coming out now, or I just haven't seen them yet. The other factor with that is these issues about stricter redetermination requirements. That could make that even more difficult and just operationally very difficult for the state of Missouri. We have a track record of not being manned up enough to handle the whole determinations process and the redeterminations. So there's many administrative losses of coverage. That still goes on. That was, really been difficult under the unwinding. And in fact, a few years ago, the former Republican representative that's running our Department of Social Services requested about 50 more positions, 50 more FTE to run the determinations component. And I think they were given like 5. So it's way understaffed just the way it is. Work requirements place a similar burden on Missouri. It'll create loss of coverage just because of administrative issues. So we've done a lot to make sure that the right people are aware of the impact of all of this. And we've even done things collectively where we've gotten stuff in the media, and we'll send this out. You'll have this link, but to remind people of the last time we did Medicaid cuts, which was back in 2005. It had a very far-reaching impact. So we know this is going to play out really badly for us. We've already seen it. We do, however, believe that there is discussion between the Missouri administration and our congressional delegation. We're quite sure that that is one reason why Josh Hawley is playing the role that he's playing, because there's been a lot of communication. He it has in fact come out as a outspoken critic of Medicaid uh, cuts, which is really fantastic to see all this. You know, he did an op-ed and published it himself, included the statement, Republicans need to open their eyes or voters support social insurance programs. More than that, our voters depend on those programs. So that's really, really good. And there's some other news media pieces about that. He's been in the media repeatedly making these kinds of statements. But the issue seems to be a little more cloudy on where he is with work requirements. He seems to be supporting those work requirements to date. That's what we think we know. And there's been some effort to call him out on that a little bit. That's a very good article, that last one down there. No one, that's actually a commentary. No one knows better than Josh Hawley that work requirements are Medicaid cuts. What I mentioned about the administrative burdens, we just will not keep up with that at all. So then you asked a question, well, what would the dental impact be of all of this? Well, basically everything we've done over many years, I am convinced would be wiped out, because deep cuts are going to require the state to look for cutting everything they possibly can cut. So those 2005 Medicaid cuts took out adult dental. We got it back in 2016. That'll go. We were fortunate enough to get our dental rates up to a commercial level, basically 80% UCR in 2022. They'll have to look at that again and take that out. We've really increased dental provider enrollment because of those rates. We've had a special project to do that, and I'll show you a little bit more about that. You can imagine what will happen with that, with a big cut. We've also continued that work. We've added various codes. We've even gotten some additional rate increases for specific codes since 2022. All right. So I'm not going to go over all this in detail. It's really the stuff in that lower right-hand corner I wanted to show you. When you compare state fiscal year 22 to 24, we've added 81,017 more Medicaid participants actually getting a dental service. So that's great progress. 694 new to Medicaid dental providers since 22. And we can also, another way to look at it is the counties that do not have a dental provider. It used to be 36. We've gotten that down to 17. All of this stuff will be swept aside if we get deep cuts. So I just wanted to provide you with some resources. We have a group in Missouri called the Missouri Budget Project. They consistently put out excellent material. So I wanted to direct you to some of their material, and how, you know, they really lay out things in detail about this. So I think I made up some of Bailey's time and got ahead. And I think if we're ready to take uh, questions, I would be glad to give you a little bit more detail.
Thanks so much, Gary. All right, let's switch to questions. I know we've gotten a couple in the chat. One, Bailey, for you is, how is the debt ceiling fitting in with all of this? Is that part of this bill? Will it impact the negotiations on this bill?
Yeah, that's a really great question. And something I should have mentioned. So one of the many things in this package is lifting the debt ceiling to a higher amount. It was in the framework that they had put together and in the House passed version. The Senate is looking to raise it by an even higher amount. I don't have the numbers off my head, to be honest. Apologies for that. But the Senate is looking to increase to an even higher amount. That is part of the reason why Rand Paul is a steadfast no, because he has deep concerns with increasing the debt ceiling. So I think at this moment, it doesn't seem to be on the forefront for anyone else's vote consideration besides Rand Paul, although he has claimed that there are others that are concerned. I think particularly as this bill goes back to the House, we know that the most dug in group of House members who voted or who were considering voting no in May were some pretty staunch conservatives who were worried about the deficit and the debt. So I think if the Senate passes a higher amount successfully, I think we could see that be a dynamic once again in the House as well. At this moment, we're not seeing it as significantly, but it is certainly a cause for Rand Paul's vote specifically. And I think it does also impact the timing aspect of this, which is theoretically by August is when they will need to have a solution to either raising the debt ceiling or eliminating the debt ceiling. Most likely raising. Elimination is something that kind of always comes up but never really happens. And they will have to do something on that by August. So their ideal is to do something through this package before that August deadline for the debt ceiling. But if the politics of this continue to be difficult and they cannot kind of get agreement by August, you could see a situation where they have to do something standalone on the debt ceiling, and that'll really complicate everything. So yeah, that's the gist on the debt ceiling.
Thanks, Bailey. And one question for Gary, and then I know we're already over time, so we'll wrap things up. But Gary, what is your argument for why dentists should not drop out of Medicaid if or when reimbursement rates are potentially cut?
Well, we've learned a lot from providers, from these new providers in particular. All along, we've learned about barriers, reasons other than just rates, why they wouldn't get into Medicaid. But we've also learned some really good things. So we've had a lot of providers come out and say, and again, these are new providers that did not work in Medicaid previously. And basically, a lot of them are saying it's much easier to deal with Medicaid, either fee for service or with the managed care plans, than it is with your average PPO. It's more reliable, it's more manageable. I've got a much better idea about what I'm going to be paid. So we didn't expect that going in. That would be the top of our argument, is even if the rates have gone down, you still have learned that you've got a workable business proposition for yourself here. But it'll be tough because it interjects instability and unpredictability. And that is the last thing you want to do when you're trying to talk people into taking on something new and different in their practice.
Thanks, Gary. All right, folks, we are short on time. And so we're going to wrap it up here. I know there's a few other questions in the chat that we can answer directly. This recording will be available quickly. That was one of the things that was asked, and we'll share on the slides as well. We may not post it to the website immediately, but I did see a couple requests for more rapid recording so that you can use it for other purposes. So we will certainly follow up with you all and send this around to everyone once it's posted to the website. Thank you guys for coming today. Really appreciate your time. I know that there is quite a lot happening very quickly on this topic, and so we'll be in touch and we'll be here for you all kind of as this continues to unfold, and we need to kind of translate what does or doesn't happen for the oral health community. We'll be in touch soon, and we'll share the resources that were shared in the chat via email as well.
Thank you all.
Yeah, thanks.